The following program is presented by the Metropolitan Library Service Agency.
Hello, welcome to All About Kids, a program focusing on the interests of children and young people and some of the issues affecting them. Today, Carolyn Hendrixson, Executive Director of Congregations Concern for Children, will facilitate a discussion of programs which benefit low-income working families. She'll be joined by Mark Neumann, Community Action for Suburban Hennepin, Jim Smith of the West 7th Community Center in St. Paul, Polly Keppel of Child Care Works, and Kathy Lamp of MinnesotaCare.
Today we're going to be talking about programs that help keep families working. I'm going to be talking first of all with Jim Smith, who is the director of the West 7th Community Center in St. Paul, and with Mark Neumann, who is with Homeline, a Hennepin County Community Action program, and Mark is a mortgage foreclosure prevention specialist, right?
That's right.
Thank you both for being here. I think we need to talk first of all about why we need to talk about programs that help keep families working. Why do we need these programs? Well, I think first of all we need to be reminded that according to the 1990 census, over 142,000 children in Minnesota live in poverty. That means that over 12% of our children live below the federal poverty guideline. And according to 1993, the federal poverty guideline for a family of four was $14,350. Families who live in poverty are families who work and families who receive public assistance. More and more in today's economy, families where both parents are working and earning minimum wages cannot make ends meet. They cannot provide the basic needs for their children, for housing, for health care, for child care, for food, clothing, and transportation. We're going to talk about some of the programs that help bring more income and more support to families so that they can meet these basic needs. We want to help you understand how these programs work, whether you're eligible for the program, how you can access the program, and also how all of us can help continue these programs, make them strong, so in turn they can strengthen today's families. Because after all, we are all responsible for all the children in Minnesota. We all have a need to be part of a society that makes sure that each child receives the protection, the guidance, and the nurturance that they need to become healthy and contributing members of our society. Jim, I'd like to talk first of all with you about how can we get more income into families. You've been part of the Minnesota Alliance for Children that has been very instrumental in getting information out to families about two tax credits that can increase their income, and those are tax credits for working families. There's the federal one called the Earned Income Tax Credit and the state Working Family Credit. Can you tell us about these credits and how families can be helped by them?
Sure, thanks, Carolyn. These two credits are crucial and important tools for low-income families, financial tools to help their economic situation. What they're trying to do, both at the federal and the state level, is to award to people certain kinds of credits so that they can supplement their own income that they're now getting already, because these are working people. Mm-hmm. They can continue to keep their jobs. Oftentimes the money goes to transportation, to buy basic needs, and helps them keep their jobs, and to decrease any dependence on welfare monies that there may be. The other important aspect of it is that it addresses somewhat anyway, and it's a beginning to address the large gap between poor and rich in our society, and that dangerous gap that continues to grow almost annually. It's a start to say to poor working people that you have earned this, that you need it, that you want it, and take it. It's yours. So that the other thing to remember is that this is a refundable kind of credit. Even if you do not owe any taxes at all, or even if you would not normally file, but you must to get both the credits, you still get the money. And families use this differently. Some families will use the money to pay what they owe on their taxes if they owe some and keep the rest. Some of the families get all the money themselves as a credit. And for many of these families, it's probably the largest check they receive, largest single check they receive throughout the whole year. So no matter how they use it, though, they're stretching their family incomes. And they're able to, one of the ways I like to look at it is it's much more than money. We're going to talk a little bit later about who is eligible and all that. But this is about much more than money. It's about, for example, parents feeling confident and feeling that they're doing a good job with their children because they have a little more income to help with their transportation, to help with their clothes, to help with their food. So this is also a self-esteem building mechanism for low-income families, and especially the parents.
So do you really see it, you said it addresses the increasing gap between what the higher income families are earning and lower income families earning. How does it impact how families then see work? How do you see that playing out?
Well, they see work as a value already, obviously.
But if they work and two parents are working and they're not making ends meet, how does the tax credit help them?
Well, it helps them, gets money in their pockets, money that they can use vitally right now for bills.
And it rewards them for
and
work.
Rewards them, exactly. It's something that they have earned. It's not a gimme. It's not a charity. The old ad that used to say, we did it the old-fashioned way, we earned it, is true. This is what they have done. And it keeps them, as I said, it keeps them employed. It's a prevention program also. People who are eligible for this, for example, have to make less than $25,000 a year. If they have two children, it's $23,700 for one child. And also there's a new group this year, which is single working people who are not in a family situation.
That don't have children.
That don't have children, correct. That if they earn less than $9,000, they're eligible this year too. But we like to concentrate today, obviously, more on the families, because this is about children today.
We know what income people have to qualify. What's the average amount that a family in Minnesota receives as a tax credit from this?
In the 1993 taxable year, which most people received this in 94, obviously, they received $1,080 average throughout the whole state of Minnesota. The highest amount is about $2,500 that a family can receive from the federal credit. Then they get another 15% of that from the state credit. But what we're talking about is very large amounts of money. Statewide, for example, 148,000 families received $160 million. And just in the 7-county metro area alone, 48,000 families received close to $64 million.
What does this mean in the lives of families? Do you have some stories of the impact that this credit has had for working families? Well,
it's crucial. It's something that, as I said, some people use it to buy a new, it's a used car, but it's a different car for them, to bring their children around to various activities, to get to work, which this is what it's about anyway. They use the monies sometimes to pay bills to catch up. One woman told us that she finally had a little bit of an edge so that she could use it to put it away for school clothes this fall and that sort of thing. For the first time in her life, she had this little bit of an edge, and most of us strive all our life to get. It was the first time she ever had it. So it becomes
what that
crucial.
means for the kids to have those new clothes.
Right, it's wonderful for them. So the other thing I wanted to mention is that we don't talk about this enough, I don't think, is that it really is an economic development program. The influx of $160 million to our stores, to our businesses, to our gas stations, and these people are spending the money on necessities, obviously, is an immense economic impact. So that I think it's something that's good for business also. It's certainly good for the families, it's good for business, and it's a win-win situation for everybody in it.
Well, we know that one of the biggest parts of a family budget is housing, Mark, and you know of some families who were able to keep their housing. It was preventing homelessness for them by being able to get the tax credit. Can you tell us about that?
Oh, absolutely. Homeline's foreclosure prevention program serves suburban Hennepin County homeowners who are facing a foreclosure crisis or a contract for deed cancellation. Over 15% of our intakes each year are crises that have been precipitated by a divorce or separation, homeowners who may be filing as a head of household for the first time and have been unaware of the earned income and working family credits. They come to our agency not knowing where to turn, behind on the payments, maybe facing a foreclosure, children and the family losing their home. The earned income credit at this time of the year has been a very valuable tool to people filing as single heads of household for the first time. At least 15 to 20 of our clients in the last year probably saved their homes as a result of the earned income and working family credits. Two particular cases come to mind. I had one woman filing as a single head of household for the first time since her divorce 7 years ago. Hadn't filed her taxes for 7 years and was in danger of losing her home and was afraid to go to the IRS, thought they were just going to come down on her real hard. I worked with the woman. We got a rough estimate of what her earnings had been, went through some old W-2s, contacted the IRS in Bloomington, and much to her surprise, rather than getting in trouble with the Internal Revenue Service, she had over $8,000 coming to her. Wow. And the first of those checks, they came in a series, came just in time to stop her house from going into foreclosure. I had another client, a single mother of one child, last January, was facing a contract for deed cancellation on the 20th. She called our agency on the 5th of January. She needed $3,100. She was filing as a single head of household for the first time. We immediately referred her down to Hennepin County to get an application in for emergency assistance with the county, and referred her to get her taxes done down at a local professional preparation service. She took advantage of a rapid refund and electronic filing, found out she had a $1,400 return coming, and thanks to Hennepin County's great caseworkers, emergency assistance, she qualified for another $1,748. Those funds came together just in time on the 19th of January to save her house.
And are you seeing people come back again and again, or is this making a real difference, a permanent difference in their lives?
This has made, for most of the clients, the people who it made a difference for last year, I have not had one of those come back. No reopens on those files. I think this has made a difference in helping people newly, with their new status as a head of household for the first time, get over that difficult adjustment period. And it's just been tremendously valuable. And we do get follow-up calls from these clients periodically to let us know how they're doing, and most of them are doing real well. In fact, the one lady got the $8,000 back, is now working, and her life has become real stable.
That's great. So it was good that you were there, plus these programs were in place. Jim, if someone's watching today and they want to find out more about the working family credit and the earned income tax credit, should they go to their local community action program, or where should they turn first?
Well, they can call the number, the hotline number. Also,
and we'll be listing that at the end of the program.
Right. Also, I would recommend that they use the people in their lives that they know and that they rely on. They can use their pastors, they can use a caseworker they're involved with, and there are 400 VITA sites, of course, throughout the state that will be helping.
And VITA sites are?
They're volunteers that help for no cost to help you prepare your taxes and know all about this earned income credit and the other credits.
And most of those people are in community centers. And
many are.
Yeah. So you don't necessarily have to pay for your tax return.
No.
There are volunteers that can help you prepare
No,
them.
and they're very well prepared.
Okay, that's great. Well, thank you for sharing these stories that show how this program makes a real difference in people's lives. We'll be back in just a minute to look at another major expense for working families, and that's child care. Now we're talking with two people who know about two other programs, a health care program and a child care assistance program that can benefit low-income working families. We have with us now Kathy Lamp, who is the director of MinnesotaCare, and Polly Keppel, who is the director of Child Care Works, which is a statewide child care advocacy group. Polly, I imagine that when families go to work, that's one of the big issues, one of the big expenses they have is paying for the child care that they have to provide for their children so they can keep their job. How much is child care cost in the state of Minnesota, and how do low-income working families afford it?
Well, Carolyn, it really is not only for low-income families, but for middle-income families. It's really a big bite out of any family's budget. For instance, in Hennepin County, licensed family child care can vary for a child from about $4,600 in a family child care home to $6,300 a year in a child care center. So if you have more than one child, just think about what that does to the cost of going to work. Childcare is an expense, and yet a parent can't be in the workplace without it.
Well, what kind of programs do we have then that can help these low-income families afford this child care? I mean, if I'm a single mom and I decide to go to work and I have 2 preschoolers, I'm going to need over $8,000, maybe even $10,000 out of my income before I can take that job. I couldn't take the job. Do we have some programs in place that can help families?
Well, we have some assistance for families. First, through our tax system, we have some aid to families. At the federal level, we have a child care tax credit for families. It doesn't come close to paying for the cost of care, but for families, depending on their income, they can either qualify for from 20 to 30% of a $2,400 to $4,800 credit, depending on their number of children. The state also has a refundable tax credit available to families, and depending on their income, they might be eligible for as much as $720 a year. Well, we just talked about the cost of care. If they're paying $5,000, that's a drop in the bucket. But it is an acknowledgement that that is a legitimate cost that parents have in order to go to work.
And if I were going to work, I could find out about that tax deduction from my employer?
You could find out from your employer. You could also find out both from our Department of Revenue and the IRS hotline numbers that are available. If your child is under the age of 13 and you're responsible for at least 50% of your child's support, then you qualify for this if you've paid someone else to care for your children. The program that exists in Minnesota that is really geared toward the low-income family and helping them work is something called the Child Care Basic Sliding Fee Program. And it really is a wonderful resource for families who need help in paying for their care.
Now, how does that program work?
Well, the program works, it's administered at the county level, and so a family would contact their local county social service office, and they would investigate the program. If they have incomes for a family of 3, for instance, up to the cutoff would be about $29,000 a year for their gross income, they would be eligible to have some portion of their child care expenses paid for. The family is responsible for a co-payment. A family that makes $18,000 a year and has 2 children may have to pay $50 a month toward the cost of care. But the program does assist them with purchasing the care. Parents are able to choose the legal care that they would like to have.
They can take their money anywhere.
They can take their money anywhere. They can use family child care. They can go to a center. They can use a school-based program. They could go to a relative or a friend who is providing the care and purchase the care. So it gives them some options that they wouldn't have if they were depending on looking at a very small family budget and trying to eke out money for childcare.
So this program, the sliding fee program, really assists the same families that are also eligible for the working family tax credit.
It really does.
Okay.
It really does. And it's in place because parents need, if they're going to be good employees, they need dependable care. They need to be able to count on taking their children to child care or that they feel good about, that they feel is reliable and stable. And the best part is that it's really good for the child.
Do you know some real families who have shared with you their story about how the child care sliding fee made a difference for them?
Well, there are families that we talk to and we hear about all the time, and all across the state. It's not just a metro issue, but families who have been on the verge of having to depend on AFDC. And because the basic sliding fee has been there for them, it's made the difference between going on welfare and being able to work. So many of the new jobs that are being created are really low-paying jobs. And for a parent to be able to pay for their basic expenses. We were hearing from a parent who was on the waiting list for the basic sliding fee. And she had her child in care. Every 3 or 4 months she had to find someone different. Her child was having really a lot of problems, was an unhappy little toddler because she never knew where she was going to go next, and the mother was really concerned, and her attendance at work was in jeopardy. And lots of parents go into debt if they're low income and they're paying for the full cost of care. So
So then when they get the assistance, they can have some stability both at work and with their
They
children's
really
lives.
can have the stability, and it's made the difference. It's given parents. It's also available to parents who are having an opportunity to get some additional training or education, so that the job they take will be a better paying job, and at some point they'll be able to be self-sufficient.
Make some progress. Great. Another big expense for family is health care. And there's been a lot of political conversations about health care in the past year. It's kind of faded recently, and it seems that maybe just families who need health care coverage are the ones who are thinking about it today. Kathy, can you tell us about the MinnesotaCare program and how it affects families?
Yes, thanks, Carolyn. This is MinnesotaCare is a state subsidized program of health care, health services for families, and it is very much a support for working parents who may not have health coverage available through their employer, and so many employers are not able to make health insurance available to all of their employees, or more often they're not able to make that coverage available to the dependents of their employee. And obviously this is a significant expense for working parents. Minnesota is fortunate to have this program available for uninsured children and their families. It's available for families pay a premium. They make an application to the state, to the Department of Human Services, and their premium is based on the family size and on their income.
So what's the cutoff for, what's the eligibility income for people to apply?
The income is for families is quite high. For a family of 4, the cutoff would probably be up around $39,000 a year. Now, obviously, most of our families are not up in that area. In fact,
you pay a higher premium if you're up
at
the
that
top.
level, they're paying the full premium. Okay. Most of our families, though, 2/3 of all of our families that are enrolled are families of that same family of 4. They're making less than $22,000 a year.
So again, the same low-income working families we've talked about with the other
Exactly.
programs. Exactly. Well, how do you see people using the health care? Do you have any measure of that? How are they using the health care for their children?
They use it just like anyone else. The purpose of this program is to make primary and preventive care services available first. So
what does that mean for those of us who just take our kids to the doctors?
Right. It means that it would be available at, there's no co-pays. Okay. For example, no deductible. You pay your monthly premium, and with your health care card, then you can go to see the doctor, the clinic that you're probably using right now. There is no co-pays. There's no reason to wait to get those immunizations, to wait to call to see whether the sore throat is strep throat or not. It plugs you right in.
Seems like that's a savings as far as healthcare costs, which is what we're always talking about, the high healthcare costs. That if I could take my child to the doctor the first time I know they have an ear infection, that's pretty cheap compared to ear surgery. Exactly,
and this program is not that expensive. I mean, the whole discussion about MinnesotaCare does focus a lot on expense, but we've had real good results from this program. The cost of serving the families in MinnesotaCare is no greater than the cost of the same cost of other working parents who have insurance through other sources.
Now, if there's a family that's watching this program and they want to apply for MinnesotaCare, would they get on it right away?
No, that's why I'm glad you asked that question, because there is an application. There may be some processing time of 4 to 6 weeks. Also, when you're notified, then we would tell you that you're eligible. We'd also tell you what your premium is, and we need to receive that premium before coverage can begin.
If a family's working, and a lot of times I think the families that we're talking about may work at one job one year and another job the next year because just of the type of employment that is. Does that health care coverage continue for their children as they change employment?
It changes. It would stay with them as long as they don't have other insurance available to them. And we try in our application to get that information about the family. What is their income and how does it vary, so that we can get an accurate picture, so to be able to determine what is the appropriate premium.
Do you have some stories of families who have told you what a difference it's made for them?
We have lots of stories, as I'm sure Polly does. We hear often from families who are just very grateful that they had this program. Healthcare is something that is so anxiety producing when you don't have it, and the expense is so intense at the time that you need it, and it's not something that you can budget for, or something that you don't necessarily want to anticipate. This program is from the families that we hear about, it's just meant the difference to them. So in the health of their children, just their general family life satisfaction. It takes away stress.
Yeah, it sounds like all these programs do that.
Yeah, that's right.
That's great. That's great. If you two had an opportunity to say, I'd like to improve the child care program or the health care programs for low-income working families, what proposal would you make, Polly, for improving the child care?
Well, I think the Child Care Basic Sliding Fee program really is a good program, and it serves families well. Unfortunately, it can serve a few of the families that are really eligible.
Okay, so not everyone who's eligible is served by this program.
No, we have long waiting lists in most counties.
What are people doing on those waiting lists while they're waiting for child care? Are they on public assistance?
Well, some of them need to go on public assistance. Some are going into debt. Some are really leaving their kids in questionable care, but they feel that going to work is so important, they just don't have an alternative. So there are a lot of undesirable kinds of shortcuts that parents need to take in order to, while they're sitting on waiting lists. So in some cases, it's a wait of a year or a year and a half.
Well, how can those of us who are citizens help with this effort?
I think if we want parents to be working, and I think that's a value that most of us really share, then I think we have to help make that possible. And that would be really increasing the resources at the state level for the child care subsidy program for those low-income parents.
So we should call our legislators and say we want more money for the child care sliding fee?
We think that it's a good program, it works, helps families, and we need more money.
Kathy, what should we do for health care?
Well, we can get the word out so that more people know, so that they're aware of this program, that they take advantage of it, that they don't hesitate, to give us a call, to make an application, and that we let people know that the financial situation for this program is healthy, and there is funding available. They don't need to hesitate to enroll.
Great, thank you, and I want to thank all of our guests today for sharing with us information on how we can support programs that help families stay working, because it really is the job of those of us who are adults in our society to assure that children have the first claim on our resources and on our attention. If children live in a responsive world where their basic needs are met, where they have housing and health care and child care and food and clothing, then they will begin to experience security and trust, and they can imagine a good future. We all have a responsibility to build that good future for children.
These advocates have described programs that really work. Thank you, Carolyn Hendrixson, Mark Neumann, Polly Keppel, Kathy Lamp, and Jim Smith. Thanks to all of you for joining us on All About Kids. Please tune in again.
This has been a presentation of Hennepin County Library in conjunction with the Twin Cities Metropolitan Library Service Agency.